Millions of people living, struggling, surviving in the Bronx every day. Each year, 40 of these people walk out of Bronx Lebanon Hospital having been told their kidneys are damaged. The causes of the damage, the treatments offered, and the physical and mental adjustments they need to make will be looked at in this video. Three major groups of patients end up on our dialysis machines. All right. Well, listen. Patients with diabetes, patients with high blood pressure, and drug abusers. You come to the emergency room, you come to the clinic, you come to the hospital. Patients with these diseases are followed closely in our clinics. Listen, I'm very upset about something. I was just speaking with a nurse. Your blood pressure is very high. Okay? The nurse tells me that you ran out of medicines and you haven't taken your high blood pressure medicines for 2 weeks now. Mrs. Thornhill's husband recently became a dialysis patient. He ignored his high blood pressure and severely damaged his kidneys. We'll ask Teresa about the symptoms that brought Eric to the hospital.
He was having a lot of pain in his stomach. And he was having terrible headaches, and then his fever, he had a high temperature also. So he started having a lot of pain, and he couldn't even walk. He was like unbalanced. And when he couldn't even walk half a block without breathing too hard, had to stop and catch his breath and then start all over. It was the same thing too, wherever we went, if we walked, like even going upstairs, he couldn't even get up a flight of stairs without breathing hard.
Frequently, though, there are no warning signs. This time, did you know you had high blood pressure?
No. The last full physical I had in 1981 by the United States Army, and I was fit. I hadn't had a physical since 1981. So far as I assume, I was fit. I was in good shape. I exercised. I did all the things a young, healthy man would do.
Many times, the cause of renal failure is not apparent. Nonetheless, after being told, there is a difficult mental adjustment that each patient must handle in his own way. Anger, denial, guilt are all expressed. Talking it over with the dialysis support team helps.
What was it like for you when you first heard that you were going to be on dialysis?
I couldn't believe it. I couldn't believe that was, I couldn't believe it. I couldn't believe it, and I had got myself mostly put myself into a shell. I thought I would be more different from everybody else. I felt that I couldn't function, that I couldn't do anything that I was doing in my life before I got sick. I shut a lot of people out, which I shouldn't have. I closed myself in, I imprisoned myself, But I only find I was being very selfish, because there's people that cared and understood. They would try to understand anybody, but I was I couldn't understand it. Or I kept thinking to myself, I'm gonna die, I'm gonna die, I'm gonna die. Why is this happening to me? Why bad things keep happening to me? Do I deserve this?
Dr. Maya told me I had to have dialysis. I cried for about 6 hours straight. I was upstairs, and I just boo-hooed and cried and cried and cried. And then I stopped and I said, well, let me think this thing over. And one of my friends came over and she paid me a visit. She didn't know that I had to go on dialysis until she got here. So she said, your eyes are very red, what happened? So I told her. So she said, listen, anything is better than being dead, because you're dead longer than you're alive. And I said, you know, she's right.
Even the needs of the Hispanic dialysis patient are met.
Y en cuanto a tu amistad, ¿ha habido cambios también en esas relaciones?
Al principio mi familia me trataba diferente, como no podía hacer nada, como una chiquita.
Medical adjustments for dialysis must also be made.
What is happening to you for almost a year or so. You came to the clinic, we knew that you had lost one kidney when you had laceration or a stab wound. Then you have only one kidney and that kidney was damaged. When you were coming to the clinic, we told you your kidney is losing large quantity of protein, and slowly the kidney gonna get worse, and one day the time will come where the kidney will not function any longer, and then you will need some kind of dialysis. So that's what the time it is. You came this time, you were very sick, your blood count was very bad, we have to put it in ICU, and we need a stomach dialysis. Now, that's just a temporary mean. What we do, we put the fluid in, took it out, we clean all the body. Now you're in a reasonably good stage where you can go without dialysis for a week or so. However, you need a long-term dialysis.
The patient is then introduced to the hemodialysis unit.
We have 6-station hemodialysis unit. And we be able to do 18 patients a day. This means we have 3 shifts of patients.
The hemodialysis machine is an incredibly sophisticated piece of machinery. Blood is washed free of its waste products through a special chamber called the coil. The patient's safety is ensured by the precise regulation of blood flow via various pressure gauges and alarms. The speed of this blood pump regulates the speed of the blood flow. Since the machine depends on drawing large volumes of blood into it, an artificially enlarged vein must be surgically created. This is called a fistula.
How does your fistula feel?
First was put in. Well, the doctor explained that it would be that way, that the fact that it was so big, you know, it's I guess you would say fatter than a normal vein. Mm-hmm. You know, you can feel the blood rushing through it. Mm-hmm. It's quiet, sometimes you can almost hear it. Mm-hmm. It doesn't feel bad now. I spent about 4 days since they did the operation on my arm.
Does having a fistula on your arm affect your life?
Well, far as sex is concerned, or even with my little daughter, I can't have them laying in my left arm because that's where the fistula is. So it might be a disadvantage. Everything has to go to the right, meaning I hold my baby in my right arm, or I hold my girlfriend in my right arm. You know, I sleep a lot to the right instead of to the left, or if I sleep to the left, I keep my arm out.
Dr. Burton Cohen has been the director of the hemodialysis unit since the beginning. We'll ask Dr. Cohen if he thinks hemodialysis is perfect, or maybe if it could be made perfect.
Well, the answer to both is no. Actually, it's not a perfect system, but I don't think it's intended to be a perfect system. That is, an individual has something like 10 times as much function as he needs, that a normal individual has about 10 times as much kidney function as he needs to support life. Now, the dialysis machine is actually designed or I don't know if it's designed is the right word, but is in fact just about equal to the human kidney. But the normal kidney operates 24 hours a day, 7 days a week. The artificial kidney operates for 4 hours, 3 times a week, which turns out to be roughly 10% of the time. You say, well, why don't we bring them up to 50%? Well, in the first place, that would mean that you'd have to stay on that kidney machine something like 10 hours a day, 5 days a week. There are very few people who would feel that the quality of life was such to permit them that.
Cheating.
Because of the limitations of the machine, patients must go on a restricted diet. A trained nutritionist speaks with every dialysis patient.
Good morning, Mrs. Jacks. I'm your renal dietitian. My name's Anita Minette. I would like to explain the diet to you since you just became a new renal patient, okay? This is your diet to keep and take home. There's nothing to remember because I'm going to explain the whole thing. But you're on a restricted diet. Your protein is restricted, sodium, potassium, and fluids.
I like chemo in one way because you got 4 hours in the machine. After 4 hours, you go home.
Did you like hemodialysis?
Well, in the beginning, no. I don't like the blood. I don't like what it does to you physically.
The other major option after hemodialysis is called peritoneal dialysis. Here, the tissues lining the abdominal cavity are used for the dialysis. Clean fluid is placed in the belly, stays there a short while, and then dirty fluid is removed. Rules regarding sterile technique must be followed to avoid peritonitis, an infection of the lining of the belly. The patient comes to the hospital 1 time per month to have the tubing cleaned by the nurse. After the fluid has drained into the belly, the empty bag is folded up and worn under the shirt. The procedure is repeated 4 times a day, every day. You have a tube coming out of your belly.
Yeah.
Right? Does that interfere with your social life or anything?
Yeah.
What happens?
Let me tell you one thing. With the tubing and the plastic bag carrying all the time, I create in my mind a complex. You know, I was afraid to any woman see me like that.
You have to do your treatment 4 times a day. How has your life been altered by that?
Well, it takes time. First of all, as far as my job is concerned, they've been very flexible. Being I work in a correctional facility, they have a nursing station, so I don't have a problem doing my dialysis on the job.
I feel that I'm stronger by being on CAPD. I feel much stronger, and with the feeling that I had, I started feeling well again. So I decided to go back to school.
Explain to them that I feel I can probably do anything. It's just it'll have to be limited. Like instead of running 5 miles, maybe I can run 2. Instead of playing basketball all day, maybe I can play half a day. Or maybe I used to play a lot of paddleball. I play 5 and 6 games. Maybe now I can play 1 or 2 games, but I still could play.
So 10 years ago, you were told your kidneys failed. You thought it was the end of your life, and now?
And now, I feel like I have a lot more years to go, a lot more things to do, and I'm anxious to do them. And I don't look back at being as sick as I was. I only use that as a teaching tool to help me to do well and keep well.
Through your mind when a friend dies and has kidney failure like you do?
Well, I realize that this is a disease, and I know like anything else that you can't live forever. I just hope I can have